Hi, I'm Dr. Jeff Glad, Chief Medical Officer of FullScript, the leading healthcare platform for providers to prescribe healthcare's best supplements, drive better patient outcomes, and scale practice growth with unparalleled efficiency. As a healthcare provider, I know that finding time to stay up to date on the latest trends and research in modern medicine can be a daunting task. That's why I'm excited to share a cutting-edge supplement course our team of medical experts worked on in collaboration with A4M and several industry experts, designed to help you navigate supplements and make more informed clinical decisions. Throughout the 16 hours of content, we'll give you the clinical context you'll need to confidently recommend supplements to your patients. The A4M Supplement Certification course is the perfect starting point or clinical update for optimizing your supplement treatment plans to ensure the best possible outcomes for your patients. Go to www.a4m.com/supplement-certification-course.html and use the promo code podcast20 at checkout to get a 20% discount. Enroll today and elevate your whole person care.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
We're in West Palm Beach at the Spring Congress for A4M's amazing event, and we have spectacular speakers, and I am really honored to have Dr. Jarrod Spencer with me, who just got off stage, and he's a sports psychology expert, but he's a mentor in changing how people can change their lives by their mental state and how they look at things. So go for it.
Dr. Erica, thanks for having me here. It's really a pleasure.
My pleasure.
My whole philosophy is clear mind, better performance in the sports world, but really for most leaders, it's clear mind, better health. And now more than ever, we see our healthcare providers burning out because their minds are so flooded dealing with all of the mental health that's actually showing up in their offices.
Right.
And so if we can help a healthcare provider to keep their mind clearer, they themselves can be better, and better emotional health, better physical health, and thus they can help others more efficiently.
Right. I agree. And you know, one thing I always wonder when people come in and they go to the doctor, if they look at the doctor or the provider and they say, do I want to be like this person or not? And if I don't, then you're better off running in the opposite direction. And the mental approach to things, the way you look at things, makes a huge difference. And the attitude, the way the doctor looks and feels, the provider, and you teach us how to do that.
You know, you're exactly spot on. And it's about emotional energy. We can feel it as we come across another person, and particularly as a patient walks into a doctor's office, they can feel that provider's emotional energy. We measure on like a scale of 0 to 100, like a report card. If it's in the 90s, that's like an A. You feel great, have a great workout, real positive. 80 is pretty good, not so bad. 70, we're starting to fatigue, and we can feel that. And 70 is a tipping point number. Anything below 70, and we begin to quickly unravel, we get very negative. And so when a provider walks in and they meet with the patient, they can feel that emotional energy right away. And
But do they know that?
They might not cognitively know it or even be thinking about it, because if I'm being really blunt about it, we need to bring more of the emotional side of self-care for providers into these conversations.
I agree.
And be more aware, not just of a suck it up, bury it, old school sports psychology kind of technique, but really the science of like your own self-care. And so if we as providers can be more cognizant of the transference of that emotion from the patient and then our counter transference back, and that dynamic in between, and then how do we repeat that multiple times a day and still have enough in the tank for our loved ones at home? That's the space.
Or maybe not.
Or maybe not, which is true. Like sometimes we're depleted, we're drained, and that's where I see so many leaders burning out because we're dealing with so much more mental health, whether you're a teacher, whether you're in healthcare, it's everywhere.
Right. And with your experience, which is with athletes primarily, how do you recommend, what do you tell people who actually are providers, like our viewership? What do you tell them?
Get on the path.
All right.
And what that means.
Be more specific.
Yeah.
Please.
Is that now that the stigma's fallen on mental health, and I marked the stigma falling during the pandemic, that was kind of a significant time for us. Now it's very important for people, especially providers, to do two things. Outside in head knowledge. What podcast are you listening to about the mind? What book are you reading? What YouTube video are you watching? Is there a workbook that you're working through? But it's the outside in head knowledge. We need to equip ourselves with more tools in the mental toolbox. That's half. The other half is the inside out learning that comes from talking about our stuff. Right? Catharsis, a freeing of that repressed emotion. As one of my postdoc mentors said to me, he said, if you want to be in counseling, if you want to be a counselor, you really should be in counseling.
Right.
Right. And I feel like now the stigma's fallen, it's very important for all of our providers to have somebody that they can experience catharsis with, that they can learn outside in head knowledge from. I'm biased to a licensed professional counselor, psychologist, legally protected dialogue. But it's very important for our providers to add that into their repertoire of self-care so they can be the emotionally healthiest version of themselves.
But they have to know that they need it.
Yeah.
How do you help the provider figure out that they actually need it?
Well, it's a lot like sports. Too often, sadly, the fall from grace happens. And then they realize I need it. But those that can be smart enough to say positively, proactively, I want to work on this. And those that do that in the sports world have this amazing acceleration of being able to handle the pressure cooker, the emotionality of being an elite level athlete on the biggest stages. And they're equipped with that before something bad happens. And in the sports world, we can all think of lots of athletes that had something bad happen, and then there's a fall from grace. I don't want our providers to be at that point. Let's start to get out in front of this thing, get more positive and proactive.
Well, it's a problem because on the heels of what we just went through, there's such a rise in mental health issues and so many problems that everybody's experiencing. And what you said, which is so true, is you see 20 people a day.
Yeah.
And everyone's going to take a piece of you.
Yep.
And how do you know when to block it, how to block it, and how to take the time for yourself?
It's brilliant. It's a brilliant question because the truth is, we're all really good at sucking it up, bearing it, pushing it through. I mean, that's actually it's not the skill set that's lacking, it's the other part of it,
right,
which is what do we do with that when we've repressed it enough? Mm-hmm. And that's the emotional self-care. And the other part of it is just downregulating our nervous system and really doing the rest, recharge, and recovery. The biggest misnomer in pro sports, high school sports, college sports is that in high school and college sports, we just grind our athletes just all day, all
right,
night, push, 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 push. In pro sports, there's a huge significant emphasis on rest, recharge, and recovery. And what tends to happen in pro sports is that whatever the science is there, eventually it makes its way into corporate, and then eventually makes it into college, and makes it down to youth. And so we are seeing that in pro sports, and what we need for our leaders across our culture and society is more rest, recharge, and recovery. It's been devalued a bit. If somebody said, hey, what's your hobby? Somebody might say, I don't have time for a hobby, right? I just have to
Or
work.
it has a stigma attached to it.
stigma attached to
You
it.
know, before COVID,
Right.
if you took time off to do anything that
Right.
was not work-related,
Yes.
there was a stigma associated with
Absolutely. And therein lies the root of the problem. We need to create a better rest, recharge, recovery plan for each of us. You know, what is that list of 10 to 20 things that each provider is doing or should be doing or could be doing, and how do we actively build that in without saying, I don't have time for that?
that. Well, if you don't have time for that, you're going to have time for getting sick and losing your patients.
Right.
That's basically what's going to happen.
Yeah.
Right.
But it's not so easy, I've seen, for like leaders to like really say like, okay, I'm gonna take care of me.
Yeah, talk to me about leaders for a second.
Yeah. I use the word leaders because even though we're talking directly to providers and people in healthcare.
They're leaders, they're healers, they're taking
healers.
care of the patients.
And the people that they're serving
Right.
are also, that's a teacher. That gentleman drives a school bus for our children. They're leaders in their own ways. But yet people, no matter what profession they're in, I'm noticing, are really experiencing this emotional fatigue this side of the pandemic.
How do how do you help them identify it? How do you help them say, hey, unless I take care of myself and unless I get serious about it,
Yeah.
things are going to fall apart?
I don't think the problem is really identifying it per se, because I think most people do. They just need to look in the mirror and they know what they're thinking. The real problem is, are you willing to say it? Are you willing to share it? And so, at least from my unique perspective on the world as what I do in health psychology, they know it. It's just, where do I go for help? Whom do I turn to? And in their defense of that question, if I'm being really candid, I don't think our culture and society is set up very well for mental health, for emotional health care to say, oh, this is what we want to do. The reality is, it was like a tsunami coming before the pandemic with lack of providers for mental health, and the mental health needs were growing. Now on this side of it, we're able to say, yes, I'm struggling, but who? Who can help me?
Right.
Where do I go?
Right.
And that's where it's sad, but we need to build that out more in our society.
Right. And how do we go about doing it?
Well, it starts from the classic analogy of like, follow the money.
True.
And if I'm being really blunt with you, like in my field, it's like you follow the money. It's like, well, everyone's starting to value it, but from top down, universities, high schools, like mental health resources for our kids, they need it, but the funding hasn't been allocated for that prior to the pandemic. Now it's starting to get more. Even companies, corporations, right? How much education are we providing to our providers on mental health?
Right.
And so when you follow the money, you can begin to see like therein lies some of the root of it. And even those people that are the poorest and maybe they need this the most, where did they access the system? But community mental health programs aren't very funded from a government level.
Right.
So the systemic solution to this is follow the money, and we've got to do more to have people in positions of power to allocate the resources to this topic that's really needed for everybody.
So let's talk for a minute about medical education. I know all we do is complain about medical education, and we have good reasons to complain about it. But we're seeing a lot of problems in the medical education because we're seeing higher suicide rates, we're seeing young people who are the future of healthcare not being able to handle this and not knowing how to do it. What do you think of that?
You are touching on a huge, significant problem that's not well addressed, and let me just get right to the root of it as I see it. When we think about our medical students today, we think about primarily our younger crowd coming in. That's not to say that somebody wouldn't be coming in later, but we think of them a little bit younger maybe late in their 20s or 30s. This is a unique time for them because these are the individuals that have cell phone addiction problems. When we think about the mental health struggles of our youth, as a psychologist, there's very little I can do to help mental health if we don't first take care of the sleep problems. Most people are averaging about 6 hours of sleep a day based upon when I speak and I ask people and they share that about 6 hours. They're also averaging about 6 hours of screen time on their phones. So nearly half the kids today are coming up with more hours of screen time than they are hours of sleep. Anxiety is through the roof, and we wonder where it's coming from. And so as these young people are coming into our colleges and into our medical schools, we have to understand that they're coming to the doorstep with an addiction problem. And the addiction to electronics is negatively impacting their sleep. Social media addiction, giving them the whole feed of like, I'm not enough, leads them to a place of private despair.
Well, how do we fix it?
Well, number one, do we provide enough of the resources in-house in our medical schools for those individuals to get the help that they need? And the answer too often is no. No, you can go outside, but we need to bring that in-house. Just like when I worked for a professional sports team, in-house, under that roof, there we have all the key pieces. We need to provide that for them. The other piece is the messaging. What is the messaging around a school when it comes to it's okay not to be okay? Is that clear? Or are we teaching them to, no, you're in medicine now, this is where you need to suck it up and bear it? Right. And if we're being really honest, a lot of the old school thinking still permeates.
Correct.
Now, what I love about this younger generation is that they are changing our culture and our society. And when they get in positions of power, I believe that this is when we're going to see more systemic change. But for right now, those people in power were oftentimes part of the generation that grew up with, like, we don't talk about stuff.
Yeah.
And this is how I went through it. So
Stiff upper lip.
Absolutely. And they might say the right things, but follow the money.
Right.
Are they actually providing the resources? How much education are we doing in the school? Not just for like, this is how we help somebody else, but how we help ourselves. And the answer is very little.
Thank you so much. This was wonderful.
My pleasure.